You know why? Because everybody deserves it, Ken. I mean, bottom line, right? It's the same patient journey for those folks as it is for anyone else.
Even after having their first hearing test, some people do wait far too long to get that help. And even mild hearing loss increases the risk for cognitive decline 2 times.
Welcome to Talking Retirement, brought to you by NJ Life and Health. I'm your host, Ken Connolly, and each week we sit down with fascinating guests who share their insights, experiences, and expert advice to help you make the most of your golden years. Today's guests are Sharon Stoor and Ira Fleischer. Sharon and Ira work for HearingLife, a hearing healthcare company with 650 locations in the United States and thousands of affiliated locations across the world. Today, they are here to lend us their expertise and to talk about all things hearing health. We will be talking about common hearing issues and how to treat them, advances in hearing health technology, how HearingLife works with clients to help give them the benefits they deserve, New Jersey-specific programs for hearing health, the links of poor hearing health to cognitive issues like Alzheimer's and dementia, and so much more. You're not going to want to miss this important conversation about hearing health, so let's dive in. So I'd love for the two of you to give a little bit about your backgrounds and what you do at HearingLife before we dive into this conversation. So I'll start with you, Sharon.
Okay, so my name is Sharon Stoor. I have been a hearing instrument specialist for almost 40 years now. And I work for HearingLife right now, and I've been with HearingLife since 2011, so it's 14 years. I test hearing, fit hearing aids, counsel, and service every single day to help people hear better.
That's awesome.
Sure
And
do.
Ira, what do you do?
So, hey, Ken, I am an area director here at HearingLife. I've been with HearingLife just about 7 years now. My responsibility is I work with awesome people like Sharon, and I have the state of New Jersey that I'm responsible for, pretty much most of the state of Pennsylvania and parts of New York as well. And I'm just here to, in some way, every day, hopefully help facilitate my team helping people hear better.
Hey, it's a great and noble mission from both you guys, and obviously a lot of great experience between the two of you. So I want to start from the beginning as if I am someone who is losing their hearing. If you talk to my girlfriend, she would definitely say I'm losing my hearing, so I might have to see you soon, Sharon. But if you are someone who's thinking about, I think my hearing's going a little bit, what exactly is the process for you guys on how you help people starting at square one?
Starting at square one, you will notice some things. So there's some questions that you might want to ask yourself. Things like, do you need to turn the TV or the radio up a little bit loud? Or do you find it difficult to pinpoint where a sound's coming from? Are other people telling you that you have hearing loss? That's where you want to kind of start. However, HearingLife will test your hearing annually for no charge to you. Our hearing tests are always complimentary. So even if you think you have a hearing loss and you're not really sure, or you're sure you have normal hearing, but you want to develop a baseline, we highly recommend to call, make an appointment. And at the appointment, we will have you come in, we'll take a look in your ears. We're going to make sure everything's healthy. We'll go through a list of questions to be sure there's no medical issues getting in our way. And then we do a full hearing evaluation, which includes putting you in our booth, hooking you up to a headset, and doing a hearing test. The hearing test will test how you hear sounds, the tones, and all of those tones relate to speech sounds. As we move further into the test, we'll also test how well you hear speech in that quiet environment, how well you hear soft speech, and how well you hear speech and noise. We'll take you out of that booth and find out how well you hear speech in a more complex environment outside of the booth with some background noise going. If there is some hearing loss, we'll compare with and without hearing instruments to see how you feel you would do if you notice a difference. And we would make recommendations from there. There is no obligation to come in and get that baseline hearing test, and it's so important. There's absolutely no way to really be 100% sure if you even have mild hearing loss without having that hearing test. So it's definitely important to have that done.
Yeah, it's incredible that you guys offer that initial consultation free, because I think it stops a lot of the cold feet, allows a lot of people to say, okay, it's time for me to go. And I'm not worried about walking in and paying $500 or something like that. But that initial consultation, that initial test is just the beginning. So, what sort of follow up can people expect, Ira, after that initial consultation and once you've been fitted and everything like that?
Yeah, you got it, Ken. And can I just back us up 1 second? Because Sharon was so thorough and amazing. But one of the things that you asked was like, where does it all begin? Right? Like, how do I get started with this? Just real quick from my perspective and the way that our company looks at it. First off, we believe that everybody that's 50 years or older should have an annual hearing evaluation. That's just our baseline of who should look at that. Then there's folks, Ken, just like you, and I know you were kidding, who says, my girlfriend says I can't hear a thing she says. While some of that might be true, and some of that might be that you guys need to talk a little bit about those things. If you're noticing those things, don't let them go. You know, our hearing evaluations are complimentary. So if you're noticing anything, just come get a hearing evaluation. And third, I'd like to add to that, if there's a history, if there's a family history of loss, right? You don't have to wait until you're 50 years old. If there's any type of family history and you're noticing anything, you should come get a baseline. We would love to tell folks you're fine, right? That's a great thing that somebody like Sharon can tell somebody. But if there's another conversation we need to have, we're prepared to have that too.
Yeah, it's great. And I was a DJ in a previous life, so my hearing might be due for a little checkup. So it might happen.
Absolutely. I'm a musician, Ken, so I get it for sure. Yeah, no doubt.
All this podcasting equipment also doubles as a music studio, so we're speaking the same wavelength.
Awesome. All right, we're getting together, it seems.
Yeah. So so you guys touched on so many great things, you know, what's square one, what that looks like once you go in. But like we said, you know, you initially say, I think something's up, or maybe like you said, Ira, it's just anybody over 50 should give it a shot. You get that initial evaluation. What happens after that? What's square two to say, you know, so to say after that?
Well, square two, I guess there's a couple different square twos, Ken, and we'll start with somebody who decides that Sharon or one of our other amazing providers in our 650 offices around the United States says, yeah, this is working for me. I want to move forward with treatment, and treatment would be hearing aids. So then there's some square twos from there. Square twos is you get those hearing aids fit. They are programmed very, very specifically for your hearing loss. It is not like anything you can buy off a counter. It's not like something that a friend of yours hands to you. Sharon has been doing what she's been doing for such a long time because there is this merging of incredible art and science that goes into how someone like Sharon gets your hearing better, right? So step two would be you'd get fit with those hearing aids. They would be very customized to your prescription, which is the audiogram that Sharon would generate based on your test. And then from there, it's not like glasses, Ken, where you put your glasses on and you see better. Hearing aids take time to acclimate to. Your brain needs to acclimate to them. There is follow-up care that's really important and necessary to hearing the best that you can with those hearing devices and the investment that you made. Great part about it is that with HearingLife, when you work with us, all of that aftercare is free of charge, right? We want people to come in. We want them to get the service that is needed to ensure the best experience. And that's why we don't want someone who might be on a fixed income or might just not want to put their hand in their pocket every time they need to come see someone like Sharon. We don't want you to think about it. We want you to come in and we want you to get the service that you need. So that's step two for those folks that accept treatment. If somebody decides not to accept treatment, they're not ready. They need to think about it. They need to talk about it. You know, the next step is that Sharon's going to keep in touch with you because what's most important here is your wellness. That's it. And if you've decided that you don't want to get help, we want to keep in touch. We want you coming back for your annual evaluations. We want to ensure there's no significant changes with your hearing. If you decided to go somewhere else, okay, that's great too. You got help. And by Sharon calling and making sure that you're doing okay, we find out that you got help somewhere and you're doing better, then our mission is fulfilled as well, right? Because our company's mission is to help more people hear better. And if for some reason what Sharon did takes you to a place where you got help, we've fulfilled our mission. Now, we believe we can do it better than everybody else. And the big reason why, there's lots of reasons, but the big one, it is folks like Sharon, right? Because there's that skill, that art, and that science is so important. But if you decided that your help came from somewhere else, we're glad to know that too. And we're always here to help in the future.
Hey, that's great to hear. So pivoting to Sharon, I was on your website earlier. I saw a bunch of different options. I saw Bluetooth hearing aids and invisible hearing aids and over-ear hearing aids. And it was a little overwhelming to even think about the different options and over-the-counter hearing aids. How do you decide what's best for somebody? What are the key differences between these different options? Like, what makes you, as a professional, say this is the best option for whoever comes to see you?
Really, we just ask a lot of questions and have a lot of really good conversation. Some of it depends on the hearing test. There are certain configurations of hearing loss that really don't do well with some of the hearing instruments. We look at dexterity. We look at cognitive abilities. We look at the power levels that they may need, and we have a good conversation about what we would recommend to be best for them. Most of the time, over-the-ear hearing aids are a pretty general fit that we can really fine-tune and make it very individual to that person's hearing loss and needs. However, with some dexterity issues, sometimes you need to look at something else that may be a little bit easier, or with some power issues that you may need to find some hearing aids that we can really pump some sound in there. And all of that we look at, whatever the patient's preference is. If it's somebody that's worn hearing instruments before, they tend to like to go back to something very similar and familiar. It's a lot of conversation, and that's what's really most important with our visits. We want to make sure not only are you hearing better, are you comfortable doing it? Are you going to be able to adapt? Are you going to be able to continue to use these hearing aids comfortably without frustration, So it really comes down to the conversation we have in the follow-up visits to just be sure everybody's doing well.
Yeah, and it seems like the follow-up is so important, and that's why I think you guys excel as well as you do, is because of that follow-up. What can you expect during those follow-up visits? Is it after the initial evaluation and fitting, you might need to change the frequency, change the power? Like, what kind of things happen in the follow-up visits?
So our world in our little office is very different acoustically than the patient's world at home. So we talk to them about what their experience has been. We make sure the hearing aids are in their ears properly. We make sure they're able to utilize any adjustments on the hearing aids if they have them engaged, or use them on their phone. And again, it all comes down to really good conversation with them. When the brain hasn't heard some sounds in a very long time, it can be a little bit tough to readapt to them. So that's a big part of the conversation. Are keys rattling a little bit too loud? Let's see if it's something you're going to adapt to, or something we have to make adjustments. Are your noisy environments being adapted as well as we can expect for the length of time you've been wearing the hearing instruments? If it's a couple weeks, sometimes it's adaptation that we're looking at. If it's a little bit longer than that, we may have to do some tweaking. There are multiple adjustments that can be programmed into the hearing instruments. I don't even know how many once you put them together, but it's incredible what they can do and what our testing can do to verify that those results are where we really need them. So that's what ongoing is. After that, once you're comfortable, we do continue to follow up as well. We want to make sure that the hearing aids are clean and working properly. And we want to retest you annually and make changes as needed to those hearing instruments. So the follow-up just never stops. Once you're with us, you're with us. So we want to make sure that everything is going well not only in the beginning, but throughout the life you're wearing those hearing aids.
Hey,
sure.
That's great to hear. Oh, go
And
ahead,
Ken,
Ira.
if I can add two things to that, if you don't mind.
Absolutely.
So Sharon talked about this ongoing care we have. We also have something every day in all of our clinics across the country from 1 to 2 o'clock every day. You can walk in the office without an appointment. You can ask for some supplies. And if something's not working right or something just feels wonky with your hearing devices, our patient care coordinators, and they're the awesome folks that run the front of our house, or our providers will take a look at your hearing aids. Maybe it's just something as a simple clean and check. Maybe there's something that needs to be adjusted or changed, but you can also come in during those times, and we can find out if we can service you right then, or if you need to come back for something that's just a little more thorough of an experience. So that's a great part of HearingLife as well. And the other thing, Sharon was talking about this acclimation period. That acclimation period is so really important, and here's why. So patients will come in, right? They'll get these new devices, and when they put those devices in their ears for the first time, or when they put something in that's either newer or a higher level of technology, they light up. You see them light up, right? That's a great thing. But then a couple of weeks later, they might not feel the impact that they felt day one, and that's a really good thing. Because I talked about the brain earlier, right? And that means your brain is starting to get all of this sound back in that it hasn't really been able to process in a long time. And that's so important for your overall health. Things like dementia and Alzheimer's, there's a direct link to hearing loss, and those horrible diseases. But what now Sharon can do, or any of our providers can do, and go, okay, cool. Now your brain's hearing this, right? And now it comes tweak number 2, right? Like Sharon was talking about, which is let's get everything firing again, because now the brain's gotten used to that first programming that Sharon had done. So all of these follow-ups, all of the care for yourself and your devices are just so important for the journey and for your total hearing health.
And I'm going to cut in again, if you don't mind, because I thought Ira was going to mention it as a second thing. But there is also a program through HearingLife that helps with your aftercare, which is near and dear to my heart. And I don't know of any other company that has it. We have a team, we call it On Demand. And I'm not sure if you saw that when you were browsing the website, but On Demand is available when your clinics are closed. And what we do at On Demand, I am an On Demand provider, and we have probably maybe about 30 of us, I believe, across the country. We take calls at night. On Demand is open Eastern time, 5 to 10 at night, and 9 to 3 on weekends. So we take calls from any clinic across the country. We have calls even from people that aren't HearingLife patients because they see us online, and try to walk them through things and answer their questions and troubleshoot with them and make sure that they are getting the help they need. If it's something we can't talk through over the phone, we will make them an appointment at their local clinic. But some of the things, hearing aids don't get clogged with wax only on weekdays when we're open. So there are a lot of things that we can help patients through when they're not able to get into our office. We can't do all of the programming. There's some federal guidelines that we follow state to state. Not all states accept other states' licenses at this point. That is hopefully shortly changing. It's in the works so that we can, move into being able to tweak programming, things like that. That's not available right now, but there are so many things that we talk people through every day with our on-demand team. Another thing that our on-demand team does to help with follow-up, we have a new user webinar. We call it Intuned. And that webinar is offered to every patient that we deliver hearing aids to. The webinar goes over a lot of the things we're talking about today, the adaptation period, how a little bit about Bluetooth, a little bit about cleaning your hearing aids, anything that follows up to help the providers in the office. It's a very short webinar. It's given twice a week. You have a couple of choices. Takes us about 20 minutes to get through, and then some question and answers. So HearingLife is all about that follow-up and that patient experience, and we have a lot of ways to take advantage of that.
Yeah, and this is all amazing information, and it's so cool to see how you guys work and the moral compass that you and the rest of the company have. Before we get into some more, technical questions, I really wanted to stop because not only do you guys love what you do, but you really help people, and I can see how apparent that is. To get into the more human side of things, what are some of your guys' favorite success stories where you've seen someone just light up, or, what are some of the more favorite stories you guys have had in your journeys in helping people?
Ken, I'm glad that you asked, and Sharon's going to give you one. I just want to let you know that we get together as a team every Tuesday morning to talk, go over some things, so we're all like clear about what our week is up to and all the things that we're doing. And we start every call by doing this same thing. Let's share some patient stories with each other, because it inspires every single one of us when we hear those things together. Because it is the most uplifting thing that I've ever seen. And I see it over and over again, and it feels the same way every time. So maybe I'm selfish about it. I go, you got to share a story, Sharon, because I know you're going to make me feel good this sleepy Tuesday morning, and it feels great every time. So I'll give it over to Sharon so she can.
Oh, so I have to think of one. There are so many. And yeah, I dig Ira out of the silence once in a while with some stories. But we have a lot of great providers, and there are always great stories. But lately, what's been happening is people who have previously worn our hearing aids and are super happy with being able to hear, and they're on their second or third set from us, have recently been telling me that their experiences are so much different with the newer technologies. And these are people who have had hearing loss since childhood. It is so nice to know that we are continuing to give them that help. And for somebody that's had, a profound hearing loss since they were real little, and they're now in their 70s, and they've been wearing hearing aids that were quite clunky, at least back when I started, they were, and loud and uncomfortable, even though they helped you. That was what was available. And they're putting these hearing aids on now, and they're going, my life has changed again. And it's and this is the best thing I've ever had. That's what I've seen more recently. And I'm sorry, I can't really think of any great patient stories in any other way. I mean, we have had a few people come in that do come into the clinic on their checkup, and yeah, this changed my life. I really, if they lost their hearing aid and we can get them something new or whatever, and they're like, you've saved my life. We hear it all the time. It's hard for people to get hearing aids that first time. So to see the change in their life and to know them over a few years, and then, a few years later being able to even change it some more is so heartwarming. It's why we do what we do.
Yeah. And that's awesome. I love everything you guys just told me. And I think it's such a cool cultural thing to have a meeting every single week where you say, here are the wins, here's how we help people, because it just keeps it rolling. It keeps the snowballing. And that's awesome. You mentioned some new technology, and this was something I wanted to ask you guys. What is some of the newer technology in hearing now, and then let's say maybe 5 years down the road, that gets you guys excited? We obviously have a lot of AI stuff hopping all over the world. So what sort of technological advances can we look for in the next couple of years in this sector?
Faster processing is what really lets the hearing aids do what they can do. And everybody knows that processing speeds and the ability to work with those processing speeds just gets better every year. The technology behind hearing aids isn't just a little amp and a wire like it was back in the 80s and 90s. It's a chip. So it's unlimited, really, what can come out next. And you mentioned AI. Hearing aids are trained with AI, and that, to put it very simply, just means that they're trained to recognize things. So instead of engineered algorithms that analyze the sound, the chip is actually trained to recognize what kind of noise it's in, or the whole environment, what water is, and bring down the annoying frequencies, or what music is, and let some of those nuances come through. They're trained just like we're trained as children to know the difference between a dog and a cat. That's what AI means in hearing instruments. So the faster the processing is, the more that they can train that chip, and the more that chip can work to make the sound more natural to you and more comfortable for you according to your hearing loss. So what's coming in the future? Oh God, I wish I knew. But the other thing that's been with hearing instruments since about 2016 that is getting better and better is Bluetooth. And Bluetooth has a new type of Bluetooth that's being rolled out, and it's called Bluetooth LE audio. And since most hearing aids are now Bluetooth compatible, most of the newer ones are moving into that Bluetooth LE audio. And what that means to the average person is, for instance, being in an airport, seeing a code on the wall they can put in their phone, and having their hearing aids connect right to the speaker system so they can hear when their flight's coming in, or going into a theater and hooking right into the system and streaming that sound right into their ears. It's amazing, and that's rolling out probably in the next couple years. It's rolling out slowly. Many people have probably seen their phones start saying Bluetooth LE compatible. So little by little, it's coming into the hearing aid world, and the hearing aids are moving into that. But speed of technology is phenomenal, so that's only helping us.
Awesome. You want to add anything, Ira?
Yeah, God, that's hard. She's so good. But I will say this, just speaking about the technology today, right? Because like Sharon said, it's the number of processors and the speed of those processors, right? Because what you want your hearing aids to do is you want there to be no lag time between what it gets and what it gives to your brain, right? And so the more processing and the faster processing, that's how that happens. But I will say, just speaking about what's the newest technology right now that Sharon is working with, and that would be a company that we work with a lot called Oticon, and their Intent One. And that's the highest technology, but their two top levels of technology have what they call their 4D sensors in them. And that's just something neat and sounds really cool. But basically what it does, and that's like the new update for this technology level that we're dealing with right now, these sensors, they understand your head movement, the environment that you're in. They know that because my head went this way, I'm speaking to this person here, even though I still have a similar volume of sound coming from here, it will prioritize the sound that your brain should be hearing. It gets the other sound and kind of moves it out of the way a little bit so you can really, so it immerses you in that environment that you're in, and very quickly, because of those processors, knows when you're in a different environment, when your body is is moving in a different way, and allows those hearing aids to compensate for all that and give you the most natural speech sounds possible.
All right. So something you mentioned earlier, Ira, was how a lot of people on fixed incomes might be afraid to get hearing care. We've already gone over that. This is a no cost evaluation initially, but we obviously have hearing aids, which can be anywhere from $500 to $1,000 to $2,000. A lot of people, I think, are scared of the price tag of getting the coverage they need. How have you guys been able to work around the fact that it is so expensive and be able to give people the care they need in a way that they can do it?
Yeah, Ken, that's a great point. And I think hearing devices really fall squarely under the old saying of you get what you pay for. Really. Because yes, Ken. You can go to your local drugstore, or believe it or not, an electronics store where you get your TV, and you can get $500 or $1,000 hearing aids, and they will make the world around you probably a little bit louder. But that's not what hearing loss is. Hearing loss isn't about everything needs to be turned up. What that can create is just more confusion for your brain and your body and yourself. So it does take someone like Sharon, who recommends medical grade devices to her patients, to have that thorough conversation about what's right for them. As far as payment, sure, we accept most major insurances. We accept many New Jersey Medicaids, which is great. But if you don't have that type of benefit available to you, we have awesome payment plans. You can get into a really, really good pair of hearing aids for as little as $92 a month. It goes from there, but we work with a company called Care Credit, which is a medical financing company, that you can use that card with us. You could use that card at the dentist. You could use that card at the veterinarian. We can get you signed up for it right in our offices. And we have 36-month no interest options, which is pretty incredible. So that can get those devices again and start you at around $92 a month. And as you have that conversation with someone like Sharon, who might make a recommendation based on your lifestyle and your type of loss for a technology level, we're talking about some really, what I would consider, affordable payment options. And here's what we want. We want people to hear better, right? So we're going to try our best to make those payment options work for folks. You could always put some money down, lower that if you'd like. Of course, you can pay for your hearing devices in full with all kinds of different major ways of paying. But if that's difficult for you, we have several different financing options as well.
That's great to hear. And something I know when we talked initially was almost this need, like you guys wanted to just help everybody, and that you're one of the few people that has continued to accept Medicaid patients here in New Jersey. Mm-hmm. Why was that so important to both the two of you and the company to make sure that the people on the lowest end of the income spectrum still got the care that they needed?
It's an interesting question, and I know Sharon looks like she has an answer too. I'll give you my short one, and then we'll get to the really good one from Sharon. You know why? Because everybody deserves it, Ken. I mean, bottom line, right? We don't cut corners. It's the same. We call it the patient journey here at HearingLife. It's the same patient journey for those folks as it is for anyone else, because they are still going through the same thing that everybody else is. So why they're deserving of less attention, less care, I don't have the answer to that, because I don't think there is an answer to that. So that's really why, because it meets our obligation of helping more people hear better.
That's great.
So lower income patients can also, be at risk for so many more health issues. And, it's important. And we're really fortunate in New Jersey that New Jersey Medicaid does pay for hearing instruments. And at HearingLife, we're really fortunate that we have a great insurance team that can bill those claims and work on that for us, so that we don't have to worry about that in the office. I think many independent hearing aid companies have done away with accepting Medicaid because it's very difficult to bill through not only Medicaid, but many insurance companies. It takes a long time for reimbursement. It's really a lot of back end effort that doesn't necessarily always pay off. But being a very large company like we are, and we have a department that really takes care of this for us, we're very fortunate. And I do have to say, in New Jersey, we have some of the best Medicaid coverage for hearing instruments across the country. We've had patients that, I know one person I'm thinking of specifically that has hearing aids through Medicaid because of a cognitive issue. He was born with, emotional delay. He was born with cognitive delay, and he really can't take care of himself, which is why, we help him as a state and as a country. But when he went to another state, he was unable to get the hearing aids without, a pretty significant copay. And this is somebody who really can't and doesn't have the abilities to take care of himself. So it really saddened me when that happened, and he was calling us and begging for the hearing instruments, and we couldn't help him at the time. He has since moved back to New Jersey and has been taken care of, but it was tough. So we're fortunate to be able to do it, and we're really fortunate that we have a great insurance team backing us up to help us with that.
Yeah, that's incredibly noble across the board because, these people obviously deserve care just like anybody else. And it's crazy that, just crossing state lines, they suddenly weren't able to. It just
Yep.
blows my mind that that's something that we have to deal with. I know we talked about Medicaid billing and insurance billing. I wanted to talk to you guys because that kind of goes into my area of expertise, which is health insurance. You guys have been backing away from managed care plans and managed care as the years have gone on. Can you guys explain what managed care is and why not only, I've talked to other hearing professionals who said the same thing, why people have had to back away from managed care plans and coverage?
Sure. And as you know, Ken, I'm not telling you anything you don't know. A lot of companies are, not just in the hearing health space, because it's not the type of care that patients deserve. So I'll boil it down that way, and I guess I'll explain a little bit more since that's what you asked. So what is managed care? Managed care is, so there's these insurance companies. We all know their names, right? And they may or may not have a particular coverage for their patients, whether it's hearing or vision or whatever it might be. So these other companies, these managed care companies come along, sell their services to the insurance companies and say, hey, we'll manage your hearing benefit through them. You don't have to worry about it. It's a benefit that you can say you provide to your customers, and we'll manage it for you. Then these managed care companies take over, and they basically manage this part of that patient's healthcare journey, right? A couple problems with that. And they come in the form of what does the patient get for that particular part of their benefit. And really what it boils down to is two things. It boils down to a lack of follow-up care, because there are very specific timing and amount of follow-up care that patients on managed care are allowed to have. And we as a company said, that's not right. And managed care contracts usually say, once their services are exhausted, they then have to pay the provider. It's in their contract, not in ours. So then we're asking patients, sure, come on back in. It's now going to cost you. And like we told you earlier, Ken, we don't charge our patients for follow-up care. But the contracts that are written from those managed care companies say that we are to charge those folks. We don't want to do that because that can stop people from coming back in for their care. So first off, the aftercare element is outrageously important, and we need to do better for our patients. The second thing is technology. A lot of these managed care companies are not keeping up with current technology because they can't. Because their business is built on such slim margins in this regard, they can't always get the latest technology from the manufacturers. And so now what we're providing with patients is either older or lower technology and a lack of follow-up. Those two things, they just don't jive with HearingLife. Quite frankly, they shouldn't jive anywhere. We said no. We've built some programs to combat that and allow our patients to get really, really deep discounts on their devices if they happen to have a managed care plan. And those super deep discounted plans are exactly what you'd get with HearingLife if you purchased your hearing aids any other way. full follow-up care, everything is included, top technology, and it allows us, again, to fulfill our mission, right? Because to us, you're our patient. To those managed care companies, you're a customer. We don't see it that way. So I think that's really kind of the long and short for us, Sharon. What do you think?
Oh, well, I will tell you from the patient standpoint, and what happens here in the clinic when I have a managed care patient. And I haven't had one in a while, but you fit that person and you go over their contract from the managed care company. Our contracts, we don't have anything to do with their hearing aids, right? So they're paying their managed care company, and you have to explain the difference between that discount program and a benefit, because they believe that they have a benefit and that what they really have is a discount program. So the explanation becomes a little bit complex when we're working with the patient. As time goes on and we work through their fitting and their follow-up care and get them really comfortable. And like Ira said, and now we want them to come back after the first year because we want to make sure they're okay. Or if there's a problem with the hearing instrument, they come back to us. They're saying, but I got it from you. And, then you sit down and explain it again. You got it from this particular company. We're a provider and we have to follow their guidelines. And now, what they're used to coming in to see us for that was included is now, could be $50. It could be $300. It just depends on the care that's needed. And it's really, it doesn't make us feel like, as providers, and not that it's all about my feelings, but it doesn't make us feel like we can do what we could do. And it's extremely upsetting to not be able to care for somebody because they can't afford to, pay the $50 fee or something like that. I will say we're somewhat flexible in some things, but we can't be flexible in everything. It would defeat, the purpose. But it becomes very difficult. And many of the patients, depending on their, age and cognitive level and support system and a few other things, may not really understand that their insurance company is working through this other plan and they do not pay for your services afterwards. And it really, it's frustrating and very heartbreaking for the people. With the plan that Ira was talking about that HearingLife developed, really, if somebody gets hearing instruments through that plan, in the long run, after that first year of service is over, it doesn't take long for what they're paying to catch up with what they would pay going directly through HearingLife and not using that managed care plan. And, I wish that they were more clear about the difference between, a direct benefit and this other random company you could go through, but it, apparently doesn't work like that when they're buying their insurance. So.
Yeah. And you know what, Ken? Sharon said something important and she said it quickly. So I just want to, when you do go through your managed care company, you're not purchasing the hearing aids through HearingLife. We are contracted by that managed care company to fit those hearing aids and provide a very truncated level of service. The hearing aids are actually coming from the managed care company. And while, like Sharon said, we will do everything that we possibly can to help those folks, there is a limit at some times, at some points, because those hearing aids didn't come from us. They're not purchased directly from us. So we have limits on what we can actually do in certain instances. And like Sharon said, listen, the great part about it is I think the managed care thing is starting to get figured out, and fewer organizations are starting to take them. And so that's a good thing. Like Sharon said, we haven't seen it in a while. And hopefully when we do, we can have the great conversation with them about what's the difference between working with us directly versus us just basically being the fitter of those devices you got from, like Sharon called it, and I'll use it again, some random company.
Mm-hmm. And I think it even goes further, where I've seen things where managed care companies have exclusive deals with certain hearing aid manufacturers, and you can only
Correct.
choose from that specific type, but they're kind of all in cahoots with each other. So it just seems unethical across the board. I mean, it's a lot.
Yes.
We'll just leave that there, Ken.
Okay, say no more. So we talked a little bit about Medicaid, which is awesome, and how robust NJ Medicaid is. Not everyone qualifies for Medicaid, obviously, but I always like to tell my clients that there's almost a sliding scale of help in New Jersey. And just because you don't qualify for Medicaid doesn't mean there aren't things that you can qualify for. Hey, look at that little dog. I like that.
Hi, Marla.
Hey,
Sorry, baby.
I'll tell you, get the cats in here in a second. But one of the things that has been interesting to me is the New Jersey HAAAD program. So Sharon and Ira, can you guys touch on the HAAD program? HAAAD, 3 A's. Always got to make sure it's right. Program,
Yes.
and how that can help people.
Absolutely. So that also is an income-based program, but not as it doesn't have the same limit as Medicaid does and the same criteria. So it's really easy for a lot of my patients to get that. And it started with a program called Pharmaceutical Assistance to the Aged and Disabled, and they moved into Hearing Aid Assistance to the Aged and Disabled. And right now in New Jersey, if you qualify for that, it is $500 per hearing aid reimbursement. So no matter how you got your hearing instrument, whether it was through through insurance with a benefit, if you had payment towards it, or if it was happened to be through a managed care plan or private pay, that that $1,000 benefit is really helpful to people in the long run. And it's very simple to claim that benefit. Once you're approved for PAAD, the pharmaceutical assistance, you send in a very quick one-page piece of paper that has your name, address, your PAAD number on it, have your primary care physician sign it, which I do think is a little bit odd since you're getting it from a hearing care provider. But you do have, that's the only extra little step you have to do. Your primary care has to be willing to sign it. Once you get the hearing aids, you have your invoice of what you have, and they want to be sure that you paid for it. Send that in to them, and you will receive your reimbursement from the state. I've never had it denied. It's a great program.
Yeah, PAAD is one of the most amazing programs I've ever seen. And just so everyone who's listening or watching this knows, currently in 2025, the income limits for both PAAD and HAAAD, it's about $52,000 for a single person and $59,000 for a married couple. So if you're on a fixed income, the vast majority of people qualify for this, and it's purely income related. They don't look at your assets. They don't look at anything you have in the bank. So it's a great option for a lot of people. Now, I want to save the best for last. I think maybe the most important conversation we're going to have today is the connection between hearing loss and cognitive decline, specifically Alzheimer's and dementia. I was looking around this week. I saw Johns Hopkins, Mayo Clinic, Alzheimer's Association. All these major hospital networks and nonprofits are starting to link hearing loss and these severe cognitive decline conditions. What have you guys seen being inside the industry about how these two are connected?
So hearing loss is one of the most modifiable risks for dementia and Alzheimer's. There is nothing to say that it's going to stop it, but if you have untreated hearing loss, you can develop that cognitive decline a lot earlier than people with normal hearing or people that have treated their hearing loss. So it's also related to memory, so people with untreated hearing loss report more concerns with memory that can also be leading to that dementia diagnosis. So you definitely want to keep that brain stimulated. If you don't keep those normal sounds of life stimulating the brain, you will end up more at a higher risk factor for memory loss that can go further into the dementia and Alzheimer's world. And people notice it. I see families all the time that once their parent has their hearing instruments, they are more engaged. They do communicate with the people around them more. And all of that wakes the brain up and helps them to not have that memory loss or not appear that they're going into a dementia Alzheimer's situation. So it's very important. Eyesight and hearing loss both can change the brain when the stimulation isn't there, and the brain kind of reorganizes itself to survive as opposed to remember things and focus on the environment and be able to hold conversations and things like that. So it's definitely important to kind of put a little bit of the brakes on that dementia happening and prolong it as much as possible. It's very important to fit hearing aids to help to diminish that risk factor.
For sure. And if I could add just a couple things to that, to kind of just boil it down to for a lot of folks, Sharon talked about that brain needing stimulation, right? I look at this and the way that it is, it's like your brain is like any other muscle in your body. When it's not used, if this wasn't being used, it would be flabby and it would be smaller than it is, and all. Your brain is the same way. Like Sharon said, sound not getting in, isolation happening, your brain can atrophy just like any other muscle in your body. And that's a bad thing. And what hearing aids do is they wake it all up again, right? I always kind of like have this mental picture of all these synapses kind of reconnecting and refiring. It's your brain muscle working out again. And for me personally, just my little personal anecdote to this is my mother passed away about 16 years ago from complications with Alzheimer's and dementia. And that was many years before I was in the hearing field, the audiological field. As I said, I've been here 7 years. Not one doctor spoke with us about her hearing. Not one doctor. And of course, we were going to doctor after doctor after doctor to try to help. And not one did. I understand that was early on in the medical field starting to understand that correlation. That being said, it's understood. So let's do something about it.
Yeah, I think I kind of want to add a bonus question based on that. Do you guys think, not serious is kind of the wrong way to say it, do you guys just think hearing loss is something people put off far too long? Like it's something that the individual patient doesn't really take seriously until it's already pretty developed? Like, what's your guys' experience with that?
That is absolutely true. It tends to take they used to say 7 to 10 years, but it's declined a little bit. It now is at about the 5-year mark. So even after having their first hearing test, some people do wait far too long to get that help. And even mild hearing loss increases the risk for cognitive decline 2 times. So that's really quite a bit. It might not sound like a lot, but it's really quite a bit. So even with mild hearing loss, where you think everything's okay and I'm not ready yet and I don't really need it, it still is creating those changes in the brain at that point that cause that. So yes, people do wait far too long. And one of the things that we run up against and we're actually really trying to be proactive with is having their primary care suggest that they go for hearing tests. So out of people that aren't wearing hearing aids. Only 1 in 5 people that need hearing instruments right now wear them. They wait that average of 5 years. And there's a couple reasons for it, but one of the biggest reason is that primary care physicians don't typically suggest them going for a hearing test. They may suggest getting their blood pressure checked. Very important. Hearing tests and vision tests are just as important to have, to keep that brain health going. One of the other questions that came to mind, or one of the things that came to mind from your questions in our conversation here as well, is that I do have a lot of people that ask me, why do I need to wear my hearing aids at home if nobody's there? And this really goes right along with the cognitive decline and the stimulation. There are so many sounds of life. People come in and they say, oh, wow, like I didn't realize the birds were so close, or, I haven't heard rain or the directional on my car in a long time. Those sounds of life all around you are so important to continue to stimulate your brain. Just a fork hitting the table or your footsteps on the floor, your doorbell ringing. Even if you're alone, it's important to keep the brain stimulated with those kinds of everyday sounds. And it's important to wear those hearing aids all the time.
And Sharon will make sure you do. She'll come in, she'll hook those hearing aids up, and she'll say, you're not wearing these.
I do.
It's kind of like when you go to the dentist and they say, you're not flossing, that kind of thing.
Exactly.
Chunk of steak versus, a program, that'll tell you. But,
For anybody that doesn't already know, hearing aids do have what I call the hearing aid tattletale. So, we can definitely relate your reports of how you're doing with your hearing instruments to the number of hours worn. We can see that all the time.
Well, guys, this has been such amazing information. It's an incredible, important conversation to have, and you guys have so many great resources and are, in general, just a great resource. So HearingLife is the company. Where can people find you guys? I know Sharon is pretty close to our office in Manchester, I believe, but where else can people find HearingLife if they want to work with you guys?
So HearingLife, we have 31 offices in the state of New Jersey. So wherever you are in the state of New Jersey, we probably have one of our amazing teams really near you. We have 650 around the United States. We are also a global organization that all we do is audiology work, and we do that in over 30 countries around the world. So you have a large network of care. And like you said, yes, Sharon's in our Manchester Township or Whiting office. So please, if you have any questions, please give a call over to the office. Maria will answer the phone, who's our amazing patient care coordinator, and then we'll get you in touch with Sharon. But again, 31 in the state of New Jersey overall.
So people can find us at hearinglife.com, put the zip code in, and they can give you the closest clinic there. There's also a phone number, and we have a team that answers the phones when people find our number on the website. There's also a chat on the website. And through all of those avenues, you can find the office closest to you and see the provider closest to you. And your visit is going to be no charge, no obligation. We will take care of you. We'll give you any recommendations, answer any questions. We're happy to see you in the offices.
Awesome, guys. So once again, check out HearingLife if you are remotely thinking you need a hearing checkup. I know you said most people wait 5 years. Do not wait 5 years. Don't do that. So Sharon, Ira, thank you guys so much for your time and expertise, and hope you have a great rest of your day.